Skilla. Enhancing careers. Chapter 5. Medical laboratories and medical tests. Medical laboratories. A medical laboratory is a laboratory where clinical pathology tests are carried out on clinical specimens to obtain information about the health of a patient to aid in diagnosis, treatment, and prevention of disease. There are two main types of medical laboratories, processing the majority of medical specimens. Hospital laboratories are attached to a hospital and perform tests on their patients. Private laboratories receive samples from general practitioners, insurance companies, clinical research sites, and other health clinics for analysis. For extremely specialized tests, samples may go to a research laboratory. Doctors' offices and clinics, as well as skilled nursing and long-term care facilities, may have laboratories that provide more basic testing services. Commercial medical laboratories operate as independent businesses and provide testing that is otherwise not provided in other settings due to low test volume or complexity. Medical laboratories vary in size and complexity and so offer a variety of testing services. More comprehensive services can be found in acute care hospitals and medical centers, where 70% of clinical decisions are based on laboratory testing. The specialty areas of a typical medical laboratory are as follows. Microbiology. It includes culturing of clinical specimens, including feces, urine, blood, sputum, cerebrospinal fluid, and synovial fluid, as well as possible infected tissue. The work here is mainly concerned with cultures, to look for suspected pathogens. Parasitology is where specimens are examined for parasites. For example, fecal samples may be examined for evidence of intestinal parasites such as tapeworms or hookworms. Virology is concerned with identification of viruses in specimens such as blood, urine, and cerebrospinal fluid. Hematology analyses whole blood specimens to perform full blood counts, and includes the examination of blood films. Other specialized tests include cell counts on various bodily fluids. Coagulation testing determines various blood clotting times, coagulation factors, and platelet function. Clinical biochemistry commonly performs dozens of different tests on serum or plasma. These tests, mostly automated, includes quantitative testing for a wide array of substances, such as lipids, blood sugar, enzymes, and hormones. Toxicology is mainly focused on testing for pharmaceutical and recreational drugs. Urine and blood samples are the common specimens. Immunology/serology uses the process of antigen-antibody interaction as a diagnostic tool. Compatibility of transplanted organs may also be determined with these methods. Immunohematology or blood bank determines blood groups and performs compatibility testing on donor blood and recipients. It also prepares blood components, derivatives, and products for transfusion. This area determines a patient's blood type and Rh status, checks for antibodies to common antigens found on red blood cells, and cross-matches units that are negative for the antigen. Urinalysis tests urine for many analytes, including microscopically. If more precise quantification of urine chemicals is required, the specimen is processed in the clinical biochemistry lab. Histopathology processes solid tissue removed from the body, biopsies, for evaluation at the microscopic level. Cytopathology examines smears of cells from all over the body, such as from the cervix, for evidence of inflammation, cancer, and other conditions. Molecular diagnostics include specialized tests involving DNA analysis. Cytogenetics involves using blood and other cells to produce a DNA karyotype. This can be helpful in cases of prenatal diagnosis, e.g. Down syndrome, as well as in some cancers which can be identified by the presence of abnormal chromosomes. Surgical pathology. It examines organs, limbs, tumors, fetuses, and other tissues biopsied in surgery, such as breast mastectomies. Various blood tests. Blood tests can be used in a number of ways, such as helping to diagnose a condition, assessing the health of certain organs, or screening for some genetic conditions. Blood cholesterol test. Cholesterol is a fatty substance mostly created by the liver from the fatty foods in your diet and is vital for the normal functioning of the body. Having a high level of cholesterol can contribute to an increased risk of serious problems such as heart attacks and strokes. Blood cholesterol levels can be measured with a simple blood test. You may be asked not to eat for 12 hours before the test to ensure that all food is completely digested and won't affect the result, although this isn't always necessary. Blood culture. This involves taking a small sample of blood from a vein in your arm and from one or more other parts of your body. The samples are combined with nutrients designed to encourage the growth of bacteria. This can help show whether any bacteria are present in your blood. At least 2 samples are usually needed. Blood gases test. A blood gases sample is taken from an artery, usually at the wrist. It's likely to be painful and is only carried out in hospital. Blood gas test is used to check the balance of oxygen and carbon dioxide in your blood, and the balance of acid and alkali in your blood, the pH balance. Blood glucose, blood sugar, tests. A number of tests can be used to diagnose and monitor diabetes by checking the level of sugar, glucose, in the blood. These include the fasting glucose test. It is where the level of glucose in your blood is checked after fasting, not eating or drinking anything other than water, for at least 8 hours. Glucose tolerance test. It is where the level of glucose in your blood is checked after fasting, and again 2 hours later after being given a glucose drink. HbA1c test. This test is done to check average blood sugar level over the past 3 months. Blood typing. This is done before donating blood or having a blood transfusion, to check what your blood group is. If you were given blood that didn't match your blood group, your immune system may attack the red blood cells, which could lead to life-threatening complications. Blood typing is also used during pregnancy, as there's a small risk the unborn child may have a different blood group from their mother. This is known as rhesus disease. Cancer blood tests. A number of blood tests can be carried out to help diagnose certain cancers or check if you're at an increased risk of developing a particular type of cancer. These include tests for prostate-specific antigen, PSA. This test can help diagnose prostate cancer, although it can also detect other problems such as an enlarged prostate or prostatitis. CA125 protein. This test can diagnose ovarian cancer. A protein called CA125 can indicate ovarian cancer, although it can also be a sign of other things such as pregnancy or pelvic inflammatory disease. BRCA1 and BRCA2 genes. This test can diagnose certain versions of genes that can greatly increase a woman's chance of developing breast cancer and ovarian cancer. This test may be carried out if these types of cancer run in your family. Chromosome testing, karyotyping. This is a test to examine bundles of genetic material, called chromosomes. By counting the chromosomes and checking their shape, it may be possible to detect genetic abnormalities. Chromosome testing can be used to help diagnose disorders of sex development, such as couples who have experienced repeated miscarriages. Coagulation tests. A coagulation test may be used to see if your blood clots in the normal way. If it takes a long time for your blood to clot, it may be a sign of a bleeding disorder, such as hemophilia or von Willebrand disease. A type of coagulation test called the International Normalized Ratio, INR, is used to monitor the dose of anticoagulants, such as warfarin, and check that your dose is correct. C-reactive protein, CRP, test. This is another test used to help diagnose conditions that cause inflammation. CRP is produced by the liver, and if there is a higher concentration of CRP than usual, it's a sign of inflammation in your body. Electrolyte test. This test is used to detect changes in the level of electrolytes, which are minerals found in the body, including sodium, potassium and chloride, that perform jobs such as maintaining a healthy water balance in your body. Changes in the level of electrolytes can have various possible causes, including dehydration, diabetes, or certain medications. Erythrocyte sedimentation rate, ESR. This test works by measuring how long it takes for red blood cells to fall to the bottom of a test tube. The quicker they fall, the more likely it is there are high levels of inflammation. An ESR is often used to help diagnose conditions associated with inflammation, such as arthritis, endocarditis, Crohn's disease, giant cell arteritis, polymyalgia rheumatica. Along with other tests, an ESR can also be useful in confirming whether you have an infection. Full blood count, FBC. This is a test to check the types and numbers of cells in your blood, including red blood cells, white blood cells, and platelets. This can help give an indication of your general health, as well as provide important clues about certain health problems you may have. For example, an FBC may detect signs of iron deficiency anemia or vitamin B12 deficiency anemia, infection or inflammation, bleeding or clotting disorders. Read more about full blood count on lab tests online UK. Genetic testing and screening. This involves extracting a sample of DNA from the blood, then searching the sample for a specific genetic change, mutation. Genetic conditions that can be diagnosed this way include hemophilia, a condition that affects the blood's ability to clot. Cystic fibrosis, a condition that causes a buildup of sticky mucus in the lungs. Spinal muscular atrophy, a condition involving muscle weakness and progressive loss of movement. Sickle cell anemia, a condition that causes a shortage of normal red blood cells. Polycystic kidney disease, a condition that causes fluid-filled sacs, called cysts, to develop in the kidneys. Genetic screening can also be used to check if someone carries a particular gene that increases their risk of developing a genetic condition. Liver function test. When the liver is damaged, it releases substances called enzymes into the blood, and levels of proteins produced by the liver begin to drop. By measuring the levels of these enzymes and proteins, it's possible to build up a picture of how well the liver is functioning. This can help to diagnose certain liver conditions, including hepatitis, cirrhosis, and alcohol-related liver disease. Thyroid function test. This test is used to test the blood for levels of thyroid-stimulating hormone, TSH, thyroxine, and triiodothyronine, thyroid hormones. A low or high levels of these hormones could mean a thyroid condition, such as an underactive thyroid or overactive thyroid. Urine test. A urinalysis is a test of the urine. A urinalysis is used to detect and manage a wide range of disorders, such as urinary tract infections, kidney disease, and diabetes. A urinalysis involves checking the appearance, concentration, and content of urine. Abnormal urinalysis results may point to a disease or illness. Stool test. A stool analysis is a series of tests done on a stool, feces, sample to help diagnose certain conditions affecting the digestive tract. These conditions can include infections such as from parasites, viruses, or bacteria, poor nutrient absorption, or cancer. Pregnancy test. A pregnancy test is used to determine whether an individual is pregnant. The two primary methods are, 1. Testing for human pregnancy hormone, human chorionic gonadotropin, HCG, in blood or urine, and 2. Ultrasonography. Testing blood for HCG results in the earliest detection of pregnancy. Almost all pregnant individuals will have a positive urine pregnancy test 1 week after the first day of a missed menstrual period.